Hello, this is Aprendemos Juntos, learning together, learning to provide care. My name is Dr. Lisette Vasquez, and this is Module 4, Optimizing Nutrition. In part 1 of this series, we're going to talk about nutrition and dementia. This module has 3 objectives. The first one is to enhance nutrition for your family member and for the caregiver through practical cooking and food safety tips. Our second objective is to discuss strategies to help the caregiver feel confident in engaging their family member in mealtime activities. And our third objective is to discuss and identify the signs of poor eating or nutrition that may require a referral to a registered dietitian or a physician. How does dementia affect nutrition? Dementia can impact nutrition in multiple ways. Often a caregiver will describe their family member as being disinterested in food or a picky eater. Over time, a person living with dementia may struggle to recognize the food and drink in front of them. They may be unsure of how to begin eating, which utensil to use, or whether they should use a utensil or not. Eating and drinking can also be difficult for a person whose routine has changed or their diet plan has changed. And as dementia progresses, the person is likely to need more support to meet their needs. Let's discuss other factors that can impact nutrition. These include a decreased sense of smell and taste, poor fitting dentures or oral pain, medications that can cause a stomach upset, or not getting enough exercise or movement. These factors can contribute to poor appetite, weight loss, and malnutrition. Malnutrition is a condition that can occur when your diet does not contain the right amount of nutrients. Nutrition is important for both the family member and the caregiver. Good nutrition is essential for the health, independence, and well-being of people with dementia. Caregivers should also be encouraged to practice self-care through good nutrition and wellness practices. My plate, mi plato, is the symbol of the 5 food groups that are needed in combination to obtain our nutrients. Combining foods gives us the opportunity to meet most of our nutrients. It also gives us the flexibility to enjoy our traditional foods. It is important that we eat more whole foods and less processed foods. Consider some simple tips to engage your family member during mealtime. There are many benefits to engaging your family member during mealtime preparation. The 3 E's below will help us to define some areas to consider. Number 1 is encourage assistance during mealtime preparation, but planning ahead is key so that your loved one feels successful. The next one is engaging your loved one in simple tasks. This can include washing or peeling vegetables or fruits, adding flour to a mixing bowl, setting the table, clearing away plates, or drying pots and pans. And the last one is just enjoy the time. Share great memories, encourage conversation around food, and make it fun and relaxing. Before starting meal preparation, it is important to follow food safety guidelines. Number 1 is to always wash your hands with soap or use disposable cooking gloves. It is also important to keep your surfaces clean. Separating proteins and produce are very important to avoid cross-contamination. In addition, we always want to chill our food promptly to avoid bacteria and cook to the right temperature using a thermometer. Next, let's discuss some simple ways to determine your family member's interest in mealtime activities. Ask yourself, what activities did your family member used to enjoy, and what do they like to do now? Do they seem interested when you're cooking, baking, gardening, or doing other kitchen activities? And what are they capable of doing today? What are some of their functional and cognitive abilities and skills? For example, should they sit or stand for simple tasks? Think about the safety aspect as well. Can some of those tasks involve activities such as cutting soft fruits or vegetables, stirring, or folding napkins? Let's also discuss how you can support your family member to eat and drink well. Think about what your family member likes and doesn't like and their past routines. Provide them with some simple choices about what they would like to eat. Also give the person gentle reminders to eat and also name the foods that are on their plate. Respecting the preferences of a person with dementia will support them to eat and drink well. It is also important to keep calm and try not to rush your family member. It's important that they don't feel hurried and are given enough time to eat. Help them maintain as much independence as possible. If the person refuses food, try again a bit later. Always monitor for signs of poor eating, swallowing or chewing issues, and weight loss. If you're concerned about your family member's diet, speak to your doctor or consult with a dietitian who can give advice on what is best in a particular situation. Always keep it simple. In this slide, you will see oats being used as an easy way to boost nutrition and engage your family member. Consider the 4 simple steps that will engage your family member in this activity. For example, your family member can help pour the milk into the bowl with oats. They can also help stir the oats and slice a banana, add it to the bowl, and sprinkle some brown sugar. This can be a fun and engaging activity. Greek yogurt is full of nutrition. In this simple activity, your family member can assist with scooping the yogurt out of the container into a small bowl. They can also help add their favorite soft fruits or sprinkle some chocolate chips or nuts. It is important to avoid nuts if there is an allergy or chewing or swallowing concern. Making an egg quesadilla with veggies and cheese is also a great way to boost nutrients. In this activity, your loved one can assist with chopping veggies, cracking eggs, stirring the eggs, sprinkling cheese, or layering the tortillas. Making homemade fideo with soft veggies is another great way to boost nutrients. Your loved one can assist by chopping soft veggies, stirring, or adding toppings such as avocado. Finger foods may actually be more eye-appealing to your family member. They can also assist with chopping, slicing soft veggies or fruits, and even stirring a yogurt dip. These are other soft foods that might be considered for family members that may be experiencing any chewing issues. Avocados provide many nutrients and healthy fats. You can add it to foods or make it the main entree. Your family members can help scoop out the avocado from the shell, smash it with a spoon or a plastic fork. It is important that your family members stay hydrated with water, unsweetened tea, milk, or a supplement. And as we close today, I would like for you to think about one tip you have learned about nutrition that you plan to utilize with your family member and one for yourself as well. Thank you for your time today.